Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, what is it with you, Viola, and these cliffhangers? What was that next thing you were going to talk about? You said it's sometimes used in dentistry and sometimes not. I'm confused. Well, we're talking about the tetracyclines. So the tetracyclines were one of the original antibacterial agents we had so many years ago. And the tetracyclines leave their mark in medicine and in dentistry because they are indeed bacteriostatic. They inhibit bacterial protein synthesis. Now, we call this class of drugs the tetracyclines based after its original tetracycline member, right? That was the name of the drug, tetracycline. You don't really see tetracycline much anymore, but you do see its two cousins, doxycycline, also known as fibromycin, and minocycline, known under many brand names, but mostly minicin. Well, what is it about these tetracyclines that proves to be challenging for us in dentistry? Well, they are pretty good antibacterial agents, but you find that they're used mostly for treatment of acne vulgaris and other dermatologic conditions like rosacea. Okay, but didn't I read somewhere that you could use doxycycline to treat periodontal disease? Well, yeah, and that's what we're going to get to next. The tetracyclines are antibacterial agents that aren't used in dentistry, but are. And I'm confused. Okay, well, we don't use them necessarily to treat dental infection. Okay, even though the American Heart Association said recently that you could use doxycycline as an alternate to clindamycin in treating, infective endocarditis prophylaxis for patients who are allergic to penicillins. The tetracyclines, like doxycycline, don't really have broad activity against the bugs that we normally find in your oral cavity. And they are also likely to cause things like GI distress, xerostomia, glossitis, and even photosensitivity. What's photosensitivity? You take a selfie and you're sensitive about it? No, sunlight. Okay. So, all right, that's one problem with the tetracyclines. The other issue, of course, is that the tetracyclines are vulnerable to interactions with ions. Calcium and iron and aluminum can chelate tetracycline and make it ineffective. And if anybody knows this next fact, it's us dental professionals. We know that the tetracyclines can cause permanent tooth discoloration and even damage to bones if given to children in their early childhood or, to pregnant women as well. So for that reason, the tetracyclines sort of fall into disfavor, don't they, in dentistry? Not quite, because the tetracyclines have an alter ego. And you know that we can use tetracyclines in dentistry to treat periodontal disease, such as Atrodox, which is doxycycline hyclate gel. We can use Arrestin, minocycline microspheres, and we can even use Periostat. Now, Periostat sort of blurs the line here because Periostat is a doxycycline formulation that you swallow in low doses. And since it reduces collagenase activity, it can be used to treat periodontal disease as well. So that's it for this edition, my friends, of Fast Facts Pharmacology. Next up, a continued discussion of antibacterial agents that have an impact on dentistry. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.